Foundations of Evidence-Informed Practice, Week 4, PowerPoint number 1. All right, so we have our focus for today is about summary research. We talked a little bit about randomized clinical trials, and of course we've gone over cohort studies, cross-sectional, case control, case series, and case report. So I have a question for you to think about. What is the defining characteristic of a randomized clinical trial? That's right. It is an attempt to influence in order to determine cause and effect. Next question is, what is a defining characteristic of observational research? That's right. There's 5 types of observational research, and we are observing rather than attempting to influence or affect an outcome. All right, randomized clinical trials. One of the primary things that is in a randomized clinical trial is there are study subjects. We are looking for qualified participants, so these are a certain population, an age group. We use something that are called inclusion and exclusion criteria. So if we're including people, we want to make sure that they fit within the guidelines set forth based on what it is that we're attempting to study. And then of course the obvious is that people that don't fit within those guidelines and parameters are excluded from the study. They are randomized into either a control or a treatment group. There are treatment parameters, which includes things like time, number of sessions, dosage, whatever it is. It's going to be a 6-month trial. It's going to be a certain amount of medication, those types of things. Outcomes are measured. Now, this is different than outcome measures. We're looking at the outcomes in a randomized clinical trial based on either the group that they are in, the control group, or the treatment group. So if they're in the treatment group, we want to find out what happened as a result of the certain intervention that we did, and we want to compare that or measure that with the control group. So we're going to take a look at outcomes of both groups. And data and findings are reviewed to find out efficacy, statistical significance, things like that. And then we want to determine if it gets published or not, which also then has to go through a peer-reviewed process. So we are going to be talking a little bit more today about summary research, but I did want to mention something about original research. So remember, original research is new knowledge rather than to present the existing knowledge in a new form. So things like basic science, observational and clinical research, single studies, those types of things are original research. Now, summary research, which is what we'll be focusing on, is that it refers to kind of a bunch of research looking at a particular subject or topic or outcome. Summarized studies can be either clinical or observational. Some terms to know as we go through this is systematic search. So this involves knowing the inclusion and exclusion criteria for a study, knowing where to look, so sources of published and unpublished data, and knowing how to search effectively. So specifically, we're looking at explicitly defined questions. We are looking at inclusion and exclusion criteria, and we're looking at how to search effectively. So the searches need to find relevant, valid, balanced data. Critically appraised means that the study has been peer-reviewed. Remember what peer-reviewed means is that authorities, experts in a field, are taking a look at appropriate studies to find out from that field if those studies were done using clinical equipoise. Were they biased? Were the researchers influenced somehow by a certain pharmaceutical company or a political group, things like that. And then we want to look at methodologies. So the methods, the results, the conclusions, and any sources of error in the data collection or the data analysis. And then finally, we want to make sure that the study is useful. Is it relevant? Is it valid? And is it free of bias? The types of summary or review research are systematic reviews, meta-analysis, practice guidelines, evidence-based textbooks, and narrative reviews or literature reviews. And those are a little bit different depending on what you are looking at, how you are looking at things, but don't worry too much about that right now. For the most part, just consider narrative reviews and literature reviews to be basically the same thing. So with a systematic review, we're using systematic methods to find all of the studies about a topic or a population or a condition that summarize findings. So these can either be quantitative or qualitative. Remember what those two things mean. And there is critical appraisal of the study. Meta-analysis uses systematic methods to find all the studies about a specific topic or condition or population, uses statistical analysis to combine results. This is quantitative only. It's critical appraisal of all the studies that they find. So here would be an example. Massage, reflexology, and other manual methods for pain management in labor. So one of the ways that you know that this is a systematic research is the search methods. You can see on here that it says, we searched the Cochrane Pregnancy and Childbirth Groups Trials Register, the Cochrane Central Register of Controlled Trials, the Cochrane Library, Medline, CINAHL, Australian and New Zealand Clinical Trial Registry, Chinese Clinical Trial. You can see that it's listing that they're looking through all of these different databases to find research that is in this concerning this topic, massage, reflexology, and other manual methods for pain management in labor. So what they're doing is they're taking all of these, they're looking at inclusion and exclusion criteria. They're taking a look at the outcomes from these studies, what were the results, and then they're going to publish what it is that they find. So you can see down where it says main results, we included 6 trials with data reporting on 5 trials and 326 women in the meta-analysis. So they're looking at really the numbers in this one, but again, they're taking a whole bunch of studies and then they're going to use the inclusion and exclusion criteria. Does this study include the population that we are interested in? Does this study include massage, reflexology, and other manual therapies, or do we need to include it? It just talks about pain management in labor, those kinds of things. They need to kind of consistently be asking these questions about what gets included and what doesn't get included in their whole, the analysis of this. So there's also something that are called practice guidelines. Now, practice guidelines use systematic methods to find all the studies about a specific topic or condition or population, provides a simple summary, qualitative synthesis, and or a statistical analysis, which is the quantitative synthesis, and it answers a broad scope of questions about a condition or population, often used by licensing boards or other credentialing bodies. Here's an example. Non-invasive treatments for acute, subacute, and chronic low back pain, a clinical practice guideline from the American College of Physicians. So one of the things that will be different when you find practice guidelines, if they don't specifically list it in the title, is that they will give recommendations. So again, they're going to take a whole bunch of studies. They're going to find out, we might use time parameters, like we're only going to look at studies from 1990 to the year 2000, and we're going to find out what the best practices were at that time. What do the articles say? What does the research say about what works the best? And then we're going to compile that and write it up, and we're going to publish this as best practices for whatever the condition, population, or topic is. Now, when we've got something like an evidence-based textbook, this is based on systematic searches to find the extensive original research, heavily edited. It's often short. There's chapters about condition, treatment, population, and it can take a long time to write and edit. I'm sure that you have seen these. You should be more than acquainted with evidence-based textbooks. So the examples would be evidence-based non-pharmacological therapies for palliative cancer care, massage therapy, integrating research and practice, and then like outcome-based massage, putting evidence into practice. So these are just 3 examples of some books where they have compiled a whole bunch of information, plus, they've got some fancy pictures in there, and then maybe they've got some little anecdotal evidence, or they've got maybe a I don't know, like a little, here's a clinical vignette or something that you can use to reiterate the information, and so that the reader then really takes that information in and holds it in their brain, so that they can use that information for their practice. So a narrative review answers a range of questions about a condition or treatment, provides a simple summary, qualitative synthesis. It's often prone to author bias, but it's helpful in understanding a large number of studies, but it tends not to be critically appraised. So an example of this would be massage in supportive cancer care. So here we can see that the objective is to review recent findings on the utilization of massage by cancer patients. One of the reasons why we know that this is a narrative study is because of the data sources. So they're compiling a bunch of information from journal articles, government and special health reports, book chapters, and web-based resources. So it's not critically appraised. They're not critically appraising specific research. They're taking a whole bunch of information, they're putting it together, and then they're reporting on that. So what they have in here is conclusion and implication for nursing practice. Because of course they're just looking for this, for specifically targeting the practice of nurses, and they're saying massage offers significant potential for benefiting quality of life when applied with proper understanding of the adaptations needed to accommodate the needs and vulnerabilities of cancer patients. Okay, to summarize the summary: research, systematic reviews, meta-analysis, and practice guidelines. They all use systematic methods to find all the available studies to answer the questions posed. It's critically appraised, the studies that are included, whereas with a narrative review or literature review, it uses a broad perspective on a topic or condition or population, and it may add more information on things like physiology or epidemiology that wasn't part of the original research. So remember that the differences are that the narrative reviews and the literature reviews, again, they tend to be kind of compiled information, and that's what may end up as a textbook. Okay, that's the end of PowerPoint number 1.